Well, hi there, Dr. Darrow.
Hello, Nita Valens. I'm looking into the video camera smiling at you.
Gosh, wish I could see you there, but we'll have to talk to the folks here and see if we can make that happen. But meanwhile, how are
the
you?
videos, I'm doing great. I'm living it up.
Yay.
The videos are on my website, which is www.lastemcells.com. For anyone who you want to watch the show later, they can go to the website. It's under resources and then radio. And I'll let you take it for a second here. I know you're ready to
thank you.
Rock and roll.
I am. I just want to invite our callers today because this is the show where if you have muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and so much more, Dr. Darrow helps people with chronic pain issues and saves a lot of people, most of them actually, from going into elective surgeries. So it's real important if you're a chronic pain sufferer or you know someone, give us a call during the hour at 866-870-5752. That's 866-870-5752. And as Dr. Darrow just said, the website for you to go get even more information or send a private email to the doctor is lastemcells.com. That's www.lastemcells.com. We are here Saturdays at 10 a.m. and again at 1 p.m. And do check out that website because you can see Dr. Darrow performing the treatments on video. So if you haven't heard of this before, check it out. And also, when you call us today, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. There's actually 264 scientific studies contained in this book. So give us a call, 866-870-5752. And let's get you out of pain today. After all, the name of the program is Living Pain Free with Dr. Marc Darrow. So we do want to get you out of pain. Shall we go to Bruce in West LA?
Yeah, Bruce, Dr. Marc Darrow, how are you doing today?
Dr. Darrow, I'm fine.
I understand you have a trigger finger in your left hand.
Doctor, I can't hear you very clearly.
You have a trigger finger in your left hand, is that true?
Well, yes. I'm a tennis player for over 50 years, and I play regularly, like 5-6 times a week. And about 2 months ago, I started to feel pain at the base of my ring finger, my left hand. I'm left-handed. And when I would make a grip, I could hold the racket okay, but when I make a grip normally and let go, that finger just stays where it was, and it won't release unless I pop it out myself.
Okay.
And I've done a little reading about it, and one of the possible fixes for it is a cortisone shot. And my general practitioner said that he'd get me to an orthopedic surgeon to have a look at it. I haven't got the appointment made yet, but I'm going to make it right away. And my doctor seemed to think that a cortisone shot will be an alternative. I know how you feel about cortisone, so can you give me information about what's my best course of action?
Absolutely. So it sounds like you have what you stated, a trigger finger, unless there's arthritis there also, which I see commonly. People come in. I just had one the other day. A woman came in and said she had a trigger finger, and hers did not catch like yours. She said it did in the past, but the knuckle was huge on her hand. It was swollen and huge, and that is a case where she maybe had a trigger finger before, and it may be unrelated to the arthritis that she had in her finger also. We did inject her finger with stem cells to help that heal. But for an actual trigger finger, the steroids often will do the job. Now, if I were to do it, I would mix the cortisone or whatever steroid I used with DMSO. So if you go to, and by the way, if you do this, you would probably want to go see a hand surgeon to do it for you. Okay,
doctor, I'm still, the volume on our reception is not very good. I can't, it's a little hard to understand. You said I should check with a surgeon and see what his diagnosis is.
Well, what I said is if you're going to see a surgeon, see a hand surgeon.
Yes.
All they do are hands.
Surgeon. He's not a specialist, though, I don't think.
Yeah, I would go to a specialist, someone who is a hand surgeon.
Okay.
Let them look at it for you, or come in, I can look at it for you. And if you go to someone else, ask them if they will add some DMSO. That's dimethyl sulfoxide. And that's a very highly volatile liquid, and it will take the steroid and have it permeate deep into the nodule around the tendon sheath that's blocking that tendon from sliding.
Okay.
So what I've found over the last 20 some years is if I add DMSO, it does a much better job, 100% better. So ask them if you have a guy you're going to see, ask them if they can get some DMSO. I keep it in the office. Most doctors don't use it, but I like it to permeate certain things like scars and nodules like that. And then we'll check and see if you've got some arthritis going. We got to get you back on the tennis court, man, and make you happy.
Okay. Doctor, can I send you an email about this for a second to clear something up?
Absolutely. So what I want you to do is go to our website, which is www.lastemcells.com. Every page on my website has a little area where you can email me, and I get emails all day, all night long. I'm working on emails in between patients. I work on emails when I wake up in the morning. I'm working on emails at night. If you become a patient of mine, you will also have my cell phone. Everyone texts me too. I like to keep in close contact. I'm very atypical of doctors because I like to stay in close contact with my patients and know what's going on, especially after a treatment. So, that should get you in touch with me, and then we'll start a dialogue, and we'll get you healed up.
I may make it. You said normally I have an HMO with United Healthcare on my Medicare. You said normally that's covered by my insurance. Your first visit.
Not if you're an HMO. We take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, and United Healthcare, and for people without insurance, we can get you a credit card called Care Credit for medical procedures. But if it's an HMO, then I don't take it.
Okay, I understand. Okay, I'm going to just send you an email later on because, as I said, the
and if you want
on my phone for some reason is very clear, and I heard you
I'm
say
sorry.
EMS, and then you mentioned DMSO.
Okay, so my phone number at the office, if you want to call in right now and see if we take your insurance, is 800-300-9300. I'll repeat it, 800-300-9300.
Very good. I've got it, Doctor.
God bless, man. Appreciate your call.
Thank you very much.
Thank you for your call,
thank you.
Bruce.
Thank you. Bye-bye.
Bye-bye. Our number is 866-870-5752. That's 866-870-5752. I bet you have some emails there with questions.
Well, actually, I want to respond to your opening on the radio show. You had a few terms that I want to comment on.
Oh,
and,
sure.
I do want people to call in because that's the most fun. Then I don't have to just talk off the top of my head, which I guess I'll be doing anyway. But
a little
it's
bit.
Always, yeah, a little bit. You can't shut me up. But what happens every show is people seem kind of shy in the beginning, and Bruce wasn't, so thank you for calling, Bruce. But I'd love to get some calls in right now, and the phone number to the show is 866-870-5752. That's 866-870-5752. So please call now. But what I'm going to do is comment a bit on some of the things you said. So you used the term elective surgery. And elective surgery means that it was your choice, you as the patient. So don't run into a surgery if the doctor says it's up to you if you want to do it. If he says it's an emergency, that's a different story. But very few of these orthopedic procedures are emergency. Of course, trauma is an emergency. You break a bone, something of that nature. That is a trauma, and that is an emergency surgery. But all the other kinds of surgeries that I see that people do and they fail, the ones that come to me, they come in because they had a failed surgery. Things like back surgery, neck surgery, all of these meniscal tears in the knee, rotator cuff tears in the shoulder, labral tears in the hip or the shoulder. These are not emergencies, and they don't need to be done. They are elective. You get to decide. Don't have a doctor talk you into them. There are ways of healing these. The way we heal them, and I've been doing this over 20 years, is using what we call regenerative medicine. That's the new term today. In the old days, we used to call it prolotherapy, which is the proliferation of brand new collagen. Collagen is the major constituent of cartilage. Can we grow back cartilage? Absolutely. I was almost thrown out of medical school because I was talking about these procedures, and my professors were telling me to shut up. They said, you can't grow cartilage. Really? Well, we've been doing it for a long, long time. And you can see before and after MRIs or X-rays to see the actual tissue growth. So don't get bamboozled by what I call the dinosaurs of medicine. They're not going to change. When they retire, as is happening, now we see more and more people doing, more and more doctors doing regenerative medicine. Today, the standards are PRP, which is taking your blood, spinning it, and taking the platelets out and injecting them. And for more difficult problems, where you've got the, quote, bone-on-bone arthritis, we're going to use PRP plus stem cells, or we may just use your bone marrow. Although I have to be honest with you, since I have been using umbilical cord stem cells with PRP, very, very few people want bone marrow stem cells because it's a procedure where I have to drill into the back of the pelvis. It's not a big deal. It takes me about 15 seconds, but patients don't want to get drilled if they don't have to. So now they're opting for the PRP plus the umbilical cord stem cells. And I know there's a lot of doctors who use fat. There's a lot of doctors who only use bone marrow, and they're bashing everybody. Guys like me, go ahead, bash. I've got a huge study we're doing showing that the umbilical cord stem cells work equally as well and a little bit better, actually, than the bone marrow. So we're going to have a giant study that's going to be published probably by the end of the year, and you'll be able to see the evidence of that. Okay? Other
great.
terms. Anita, do you want to ask for a caller? When you pipe in.
Yeah, I would love to do that. And I want to remind you that the hour goes quickly, so please do give us a call at 866-870-5752. If you're just tuning in, this is Living Pain-Free with Dr. Marc Darrow. And stay tuned, because if you're in chronic pain, and 40 to 50% of Americans are having chronic musculoskeletal pain, so it would be prudent of you to listen in and give us a call. And the number again is 866-870-5752.
I also want to mention before I go on that this book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate, is free if you call on the show right now. So give us a buzz and we'll send you out a copy of that book. It took me 5 years to write it. It's got a lot of information for you. And if you like, we can send, or we can give you extra copies you can give to your doctor to teach them the value of just getting an injection rather than getting a surgery. Too many of these surgeries fail. We had a doctor who was a neurosurgeon on the show many, many, many years ago, and he was asked, what is his percentage of success doing neck and back surgeries? And he hesitated for a second. He said it's less than 50%. That means it's an even chance that your surgery is not going to work out on your neck and back. I think it may be even worse. I'm not sure of the numbers on knees and shoulders and all these other surgeries that shouldn't be done. And I know any surgeon listening to me is not going to be happy about what I'm saying. But it's not about the surgeons. I love them. They do the hardest work in medicine. The risks are so high. I've seen more than one person die during the middle of a simple surgery. Don't ask me why that happens. It's just part of opening up the body. Some people get infected. Sometimes these joint replacements don't fit right. There's just all kinds of things that can happen, and they don't need to happen. You don't need to get a surgery unless it's an emergency. So be careful. Another term you used was chronic pain. I just wanted to say quickly that chronic generally means more than 3 months. And acute is the opposite, which is, just chronicity, time. Acute means brand new. So a lot of people come in and say they've got acute pain in their knee for 10 years. What they're trying to say is that they have very bad pain, but acute is a time essence, and it means recent. So just terminology when you're talking to your doctors on how to communicate better. Now you want me to take a question?
Well, sure, except I would like to give you an opportunity to talk about other things going on in the office, if you like.
Yeah, excellent. My beautiful wife, Michelle Darrow, is a nurse practitioner, and she does what I do using cells from your body. And the vampire facelift is one of the treatments, which is a very cool name. And all it is taking your cells and injecting them into the face to regrow the collagen and make the face a lot younger. It works very, very quickly. Also, she does hair rejuvenation. She injects your cells onto your head, and a lot of people get that. And these procedures, believe it or not, are done by men just as readily as they're done by women. Everybody likes them. The other thing we have in the office is the ideal protein diet, from which people lose about 15 to 20 pounds a month. And if you have lower extremity pain, your hips, knees, feet, legs, toes, whatever it is, I'm going to ask you to lose weight if you're overweight. And I don't mind if you do it by just cutting out your carbs. That'll do it quick. But most people can't do that. Most people say, well, I'll just do it myself. And then they come back 2 weeks later and they haven't lost much. It's very difficult to do it on your own. It's very easy to do it with this particular diet. So please don't get mad at me if I mention your weight. There are many studies that show that if you are overweight, you can create your own knee arthritis. So please, please, please think about thinning out. Being thin is the healthiest thing you can do, not for your joints, but for everything. It can get rid of type 2 diabetes. When you're eating carbs, you're shooting your insulin up, and that is inflammatory, and we think is the cause now of heart disease, cancer, and so many other diseases we don't need to have.
And what's that formula that you use for the number of pounds someone is overweight? And then
well, if you have an extra pound on you, that's 4 extra pounds on your knee. If you've got 50 pounds extra, that's 200 pounds extra on your knee. Think about what it's like carrying a bag of bricks that weigh 200 pounds on your back. What do you think your knees are going to feel like? You think they're going to become arthritic? You bet. So it behooves everybody to stay skinny.
Well, you and I do that.
We work at it. It's a daily chore.
So give us a call and talk about your chronic pain of 3 months or more at 866-870-5752. That's 870-5752 and go to Dr. Darrow's website, which is lastemcells.com. That's lastemcells.com.
So, Anita, for your own education,
Yes.
we do take care of acute injuries. You said bring in your chronic pain. Well, yes, but we take care of all musculoskeletal pain. For example, let's say someone ripped an ACL, the anterior cruciate ligament, surfing this morning. What's the best treatment for that? Get them in the office, draw out the blood under ultrasound. Okay, because that ligament, if it's actually torn, is going to blow up the knee very, very quickly. And it's going to clot unless we get it out. If it clots, you lose range of motion. And some people lose their range of motion in perpetuity, meaning they can't get it back. So the first thing to do is not to consider a surgery. Most ACL repairs don't need to be done. So the first thing to do is get the blood out, get that fluid out. I use an ultrasound so I can see the fluid. I can put the needle right into the fluid. It doesn't hurt. We numb it up. And all that fluid, every single drop of blood comes immediately out, and the person heals right up. The studies show if you've got an ACL rupture, do not operate for 3 months. Let the knee heal first. The results are better. But most people with an ACL rupture do not need a surgery. Why are they being done? You tell me. I don't know the answer. Most people that have an ACL rupture, I can help fix. So, I mentioned the story of a surfer. That's actually a true story.
Okay, well, we learn every day. Excuse me, we learn every day.
He's surfing again.
See?
He's got an ACL rupture, but he can still surf.
Well,
But we got that blood out. We did some stem cells on him. I think he had 3 treatments of stem cells, and he's back to his sports again.
well, it means that we have to take care of something right away that happens. That's also what it means.
Oh, yeah. You got something nasty that happens. Don't sit around. Get to the doctor and have him take care of it. But please check and see if you need to have a surgery. You're not going to get a different answer out of different surgeons.
They'll all say have surgery.
Well, the answer, though, is get surgery. My answer is regenerate the area by doing some injections. Grow back the tissue. It's a lot simpler. It's a lot easier. There's basically almost no side effects to it. There could be, there's often something that could happen, but generally the worst that happens is you get a little bit stiff from the inflammation we create in order to draw fibroblasts to the area to grow the tissue back.
And there it is. And you're listening to Living Pain-Free with Dr. Marc Darrow. Give us a call, 866-870-5752. That's 866-870-5752. Check out the website. Look at those videos of Dr. Darrow performing the treatments at www.lastemcells.com. That's lastemcells.com.
So we have an email while I'm waiting for callers here. We have a caller coming in. This email is very short and sweet. When a person has multiple areas of the body to be treated, can these areas be treated with PRP or stem cells in parallel, or do they have to be treated individually for the best results? If individually, what is the recommended time between treating the different areas? Excellent, excellent question. So I have treated, I'm going to say, entire bodies, almost every single joint at one time. Sometimes people will fly in from another country and they can't stick around and they can't come back. So we'll just treat many, many, many things. And some of these things are actually done prophylactically. Hang with us. We're going to the break.
So you're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information about to come your way, and we'll be right back.